Hi, Brian Degenhardt here with an update on our work at the Practice-Based Research Network, DO-Touch.NET. Just like the global community, in March, DO-Touch.NET changed almost overnight. We went from preparing and hosting our annual meeting just prior to the American Academy of Osteopathy's convocation, where we focused on a new and exciting initiative to figuring out how we are going to respond to the COVID-19 pandemic. Within 1 week of returning from the convocation, we recognized DO-Touch.NET's opportunity and responsibility to facilitate osteopathic manipulative care for COVID-19 patients and to monitor the safety and efficacy of that care. We quickly disseminated a video worldwide that provides training on the treatment protocol from the multi-center osteopathic pneumonia study in the elderly. This treatment protocol was based on osteopathic principles and the profession's experience treating pulmonary infections, especially during the 1918 influenza epidemic. The only necessary update for the video was to emphasize the importance of treating patients while wearing personal protective equipment. We then posted newly created videos for caregivers and individuals that demonstrate some therapy approaches based on osteopathic principles that might help the body defend against the virus. Then 2 weeks after the convocation, we reached out to DO-Touch members to see who would be interested in coordinating medical record documentation of COVID-19 patients who receive osteopathic manipulative care. This coordination will allow the network to meaningfully assess the impact of manipulative care on COVID-19 patients when the initial crisis of this pandemic is over. Since we began responding to the pandemic, 39 members have joined DO-Touch.NET, and over 60 have indicated their interest in supporting the important and timely COVID-19 OMT research project. In just 3 weeks, we have identified 9 osteopathic physicians who have provided 167 treatments to 144 COVID-19 patients. And we will be updating these numbers weekly on the DO-Touch.NET website. Every day, we're looking for more clinicians to join us in this effort. As the world struggles to find the best way to manage this pandemic, we need to do our part to generate evidence and not just an anecdote of what the osteopathic approach contributed to society in addressing this crisis. For those of us who are treating COVID-19 patients with OMT, now is the time to make sure we are recording meaningful and generalizable interventions, biomarkers, and outcomes on these patients. Now, not in a month or in 6 months, we need to build the scientific groundwork to evaluate the efficacy and safety of OMT for this condition. Don't wait. Get involved today.